Hello, we're going to talk to you today about peripheral neuropathy and how you can get rid of your peripheral neuropathy. Our goals in this talk are to help you obtain maximum health. I'm going to give you a lot of great information today and help you to beat your neuropathy naturally without drugs or surgery. And I know you've probably been told that you have to live with your problem. I want you to understand that this isn't something you have to live with, and no matter who's told you that or what you think about it. Another goal is to help you get your life back. You know, what are you wanting to do right now that you aren't doing? What's this neuropathy keeping you from doing? Playing with your grandkids, doing activities, taking care of yourself. You know, I want you to help you get your life back and get you back to those activities that you want to do. I'm going to show you the newest medical breakthrough treatment for peripheral neuropathy. And this is without any drugs or surgery. It's all natural. I want you to know I do not treat or cure peripheral neuropathy. I address the cause of neuropathy and help support your body. And I want you to know there is hope for you. There's hope, okay? I'm Dr. Kirk Price. I'm a licensed chiropractor. I've been in practice since 1986. I'm licensed by the Pastoral Medical Association. I graduated summa cum laude. I scored in the top 1% of the final national boards test. I am a published medical author. The published material was named Fibromyalgia, Chronic Pain, Fatigue, and Insomnia. You can get more information about neuropathy and what we treat there with the neuropathy at springfieldneuropathy.com. I urge you to go to that site, look through it thoroughly, and study that and get more information there. Alright, so what are the symptoms of neuropathy? You might have neuropathy, you might have already been told it, you might think you do, you might not be sure at all. And neuropathy is going to be a lot of problems with your arms and legs. Alright, foot or leg numbness or burning, foot or leg pain, it can be even foot or arm or hand pain as well. It's more common in the lower extremities in your legs. Balance problems, if you're having trouble balancing, almost feel like you're drunk sometimes or falling. Can't feel the surface under your feet while you walk. Burning sensations, wrist, hand, finger pain, shooting pain, sensations in your hands, arms, or your feet and legs, electrical sensations, prickly sensations in your hands or your feet. What are the causes of peripheral neuropathies? Well, the peripheral neuropathies go with a lot of conditions like diabetes, smoking, chemotherapy, vitamin B12 deficiency, peripheral vascular disorders, different types of prescription medications, and some other things as well. So what are the things that are most important to those nerves? And in peripheral neuropathy, what's happening to those nerves? If my arm is the nerve, this covering, this clinic jacket, the sleeve on this arm would be the covering on that nerve, which is known as a myelin sheath. It's the covering that helps insulate the nerve, that helps it fire back and forth. In peripheral neuropathy, what happens is that covering starts dying off, all right? Those peripheral nerves have a very high metabolic demand, and they have to have the pH levels, the acid levels in your body to be at certain levels. They can't be too high or too low. The oxygen levels have to be high, the glucose levels have to be just right, and the nerve activity has to be there. Like the old saying goes, if you don't use it, you will lose it. And the nerve activity is nerves, all the different parts of those nerves have to function, like the vibratory sensation of the nerves, the joint proprioceptive aspect of the nerves. There's lots of different parts of that nerve, and they all have to fire a lot for it to stay active and working correctly. So we went over the diseases with that, but what's the actual things that makes this neuropathy happen? Well, three things here, big things. Inflammation, decreased immune system, and toxicity. Inflammation is where you're getting fluid built up in the body, and irritation in that area. Your immune system is what helps keep you well, fight off things. You get a decreased immune system response. Toxicity, you get toxins built up in your body. We're going to go over these three different things here and what makes these things happen. All right. So what causes this inflammation, toxicity, and your decreased immune function? Well, number one, acidity. We talked a little bit about that already. Too much acid in the body. You get too much acid from eating too much junk food and other food that's not good for you. Free radicals, excitotoxins, infections, and autoimmune conditions. And we're going to talk about each of these a little more in length coming up here. You might not have heard of some of these things, but I'll try to explain them to you the best I can. So, number one, acidity. That's one of the biggest problems of all these is too much acid in your body. This acidity, like we talked about, comes from poor diet. It comes from toxins we get in our body. It comes from heavy metals. And it comes from dental infections too with that. Poor diets, like we talked about fast foods, packaged foods, junk food. The optimum pH should be between 6.4 and 7.0 on the pH scale. Anything lower than 6.4 is too much acid. All right. And the best, most accurate way to test this is to get the first urine in the morning and test that to give us our most accurate reading. So this optimum pH is 6.4 to 7.0. Less than that means you have too much acid in your body. Greater than 7.0 isn't better either. That means that your acid level is so high that your body is trying to break down the bone and actually breaking down the bone and decomposing your bone in order to increase the calcium and mineral levels inside your blood to help lower your pH. Alright, so the way to test this, we just use a pH test strip. You can do that first thing in the morning, stick that under the flow and get the check and see exactly what that is. Too much acid, then your body is going to take the minerals, like calcium, magnesium, and other trace elements out of your bones. It's going to decompose your bones. It's going to be osteopenia, weakened bones, osteoporosis. It's going to start that whole complex happening. When you have too much acid, you're too acidic in your body, then your body also has a much greater risk for heavy metal toxicity. It means it can bring heavy metals in a lot easier. Heavy metals have an easier time getting into your body when the environment is right, and the environment they need is a high acid environment. So how can I get rid of this acid in my body? Change your diet. Start eating better, right? Get rid of the three white trashes. We've got white sugar, white flour, and white salt. You need to eat lots of vegetables, organic vegetables without the toxins on them, and you need to drink a lot of water, good water, filtered, pure water, not tap water. It has a lot of chemicals laced inside there. You need to take some supplements to help increase your pH, but you need to take the right ones. There's certain supplements that will increase your pH, and there's certain supplements that will increase your pH without adding toxins to your body as well. Second cause after the pH is free radicals. Free radicals damage the mitochondria inside the cells. Mitochondria are the part of the cells that provide the energy for your cell to function. They're very important for every action of the body. What causes free radical damage? Trans fats in your diets, hydrogenated oils in your diets, the white trash again. You can see how bad they are. They come under a lot of different headings. The white sugar, white flour, white salt, food sensitivities, gluten, dairy, and soy. We're going to talk about these a little bit more later too. Back at this white trash here, white salt is just regular table salt, or even the some of the sea salt that you can have has some metals in there because they harvest the sea salt through metal filters that can get metal in there. There's something called pink salt that is the best salt to have for pH for your body. What also causes free radicals? Well, there's toxic chemicals, hormones and pesticides. Hormones you can get from your meats and dairy products. Pesticides on fruits and vegetables. That's why organic fruits and vegetables are so much better than just your regular ones. Third cause of free radicals, heavy metals. You've got heavy metals maybe in your teeth with mercury fillings. Maybe you have some nickel dental crowns with that. Aluminum in deodorant. That's a really high amount of aluminum that you get in deodorant. Any type of antiperspirant is aluminum. All right. Packaged foods, hair dyes, a lot of things have heavy metals in them. Vaccinations have heavy metals. Another cause for this peripheral neuropathy is excitotoxins. And these are things like MSG, which is a preservative in food, monosodium glutamate. Aspartame, or what's commonly known as NutraSweet, is a horrible product for your body. And homocysteine levels are markers inside your body that tell you how much excitotoxins you have. So you want to have lower levels of homocysteine. Alright, so when aluminum, this other metal, binds with excitotoxins, the other thing, the metals and excitotoxins together, like NutraSweet or glutamate from MSG, they can penetrate into your brain much easier, and aluminum increases the iron-induced free radicals, a lot more free radical damage. A lot of this information are in all kinds of articles. Here's one published by Robert Marshall called "The Overlooked World of Chronic Infection and Neurodegeneration," and it's a reversal using nutraceutical agents with that. And he quotes a lot of other articles in here too, so that's why I put this one up here. If you go to that one, it has some references in here that will give you a lot of information. Number 4 cause of neuropathy, infections in the nerves. You can get an infection in that nerve that will destroy that myelin sheath as well. The number 5 cause of neuropathy, autoimmune. What's autoimmune? Well, this is where your body starts attacking itself, thinking it's something bad. All right, it just doesn't recognize that it's its own self. It's like a dog chewing on its leg, or it's like in the war when there's friendly fire, we're hurting ourselves. All right, autoimmunity is where your body is attacking its own self. The biggest causes of autoimmunity, these 3 things we talked about earlier: gluten, dairy, and soy. Gluten and dairy are huge ones. Gluten, over 80% of the people in the United States have sensitivities to gluten. They changed wheat back in the 40s and 50s, and now wheat has 500 times more gluten in it than it did back then. And what this gluten does is it causes your body, as you get older, to have more autoimmunity, where it starts attacking itself more. And each further generation has more autoimmune response from the gluten as well. So that increases each generation and also in your lifetime with that. So all 3 of these can cause a lot of autoimmunity. Your best is to avoid all of those. This neuropathy, I want you to know that peripheral neuropathy is a progressive condition. And what it's going to do is it's going to keep getting worse unless something's done to reverse it or stop it. Medications don't reverse or stop it. They might hide some of the symptoms. There's no surgeries that they do. So surgeries and medications are not the answer. Alright, the next thing I'm going to do is go over some of the neurological pathways to show you why we have to get some working for some of the other ones to work better. Alright, so in your arms and your legs, you have these large diameter afferent nerves, and they're called large diameter afferents because they're larger than the other ones with that. And these are the ones that give you sensation, and they don't give you pain, but they sense what's going on with your body. And these are the ones that are dying off, that peripheral neuropathy, where that covering, that myelin sheath is dying off, and that's the large diameter afferents. These large diameter afferents, we're going to abbreviate this LDA, come in the posterior root of the nerve into the dorsal horn, and they're going to go up the back part of the spine into something called the gracile tract. They're going to stay on the same side of the spine, so we're going to call these ipsilateral. They're going to go up here to the medulla. There's a nucleus here called the gracile nucleus. They're going to form a connection with a second neuron here. It's going to go across the internal arcuate fibers on the opposite side of the spine now, up through the brainstem here, all the way to the thalamus and a specific nucleus called the ventral posterolateral nucleus, and we're going to call that VPL right here. From here, it meets with the third neuron, who goes up to your primary somatosensory cortex in the brain, which is Brodmann's area 3, 1, and 2. Okay. All right. Now the small diameter afferents, these are your pain fibers, and there's two different types of these. There's your A delta and your C fibers. Your A delta small diameter afferents are your acute fibers, and that's going to happen if you just started having pain recently. And you can tell if it's the acute fibers because you'll be able to tell us the pain is right here, the pain is right here. I know exactly where it's at. All right. And these fibers, the small diameter afferents, are going to come in the same way the large ones did. But in this dorsal horn, they're actually going to form a connection with the second neuron here in something called lamina 2. It's going to go across the opposite side, so we're going to call these contralateral, through your anterior commissure, up to your anterolateral tract. They're going to go up the spine here, meet with these large diameter afferents to the same nucleus, the VPL of the thalamus, meet with the third neuron up to the same area in the somatosensory area in the brain with that. Now, these are the ones that give you pain, the small diameter afferents, all right? These are the ones that are dying off that cause these pain fibers to fire, okay? And let me explain what happens. These small diameter afferent nerves fire all the time, all right? But you don't have pain until you get up here to this thing called the thalamus, all right? So we're gonna put pain right here, all right? When this message gets up here, the brain now says, I have pain with that. When these large diameter afferents come in the dorsal root here, before they go up, they send a collateral off, a little branch, to where that small diameter afferent's coming in, and it blocks that signal from going here on up the neural chain to your brain to register as pain. So when that gets blocked, your brain says, hey, there's no pain, I'm feeling good, all right? When it doesn't, the pain says, ouch, there's a problem there, all right? So when these nerves start dying off, they aren't working as good, you get more of these impulses going through, you get more and more pain, all right? So that's why we have to get these large diameter afferents working better to naturally block that pain of the small diameter. All right, so what do we do with our treatment, all right? Well, there's several things that we do here. First of all, we need to make sure we get a good functional neuropathy nerve examination, evaluation, so we know exactly what's going on. Second thing is we have to stimulate that peripheral nerve, all right? And that's why I was talking about getting that large diameter afferent nerve working better again, all right? Another thing we need to do is increase the cellular energy inside the cell, and the ATP, which is the energy of the cell, and get that working better inside those nerve cells. And the biomedical nerve nutrition, both of these things together include things like we talked about with the pH, the oxygen levels, and the glucose levels. And another thing is the peripheral balance feedback coordination. This is where we make sure that the brain is balanced correctly, and if it's not, we're going to work on certain exercises that we can do to help balance that out. All right, so what do some of the patients say about here? And this is why I love working with the patients and doing what we're doing, because people like John are great people to work with. And John gave us his testimony. He's had peripheral neuropathy for several years. I've also had some other health issues along with that, complicating it. I thought nothing could be done for my numbness and pain in my toes, my feet, and my legs. I was concerned at first, but I soon noticed after I started treatment that my feet were tingling when Dr. Price ran the laser over my feet. Before, I couldn't feel any of the tickle. I couldn't feel anything at all. It wouldn't even tickle. Yay, the feeling was coming back to my toes, feet, and up my legs. Now I can walk without my feet aching and having feeling in my feet and legs now. So that's awesome. When he's coming in, just walking in on this wood floor hurt his feet. And he's doing so much better now. It's a night and day difference with that. So yes, peripheral neuropathy can be reversed and it can be stopped and eliminated naturally. And the drugs aren't going to do that, and surgery is not going to do that. All right. Want some more information? Again, go to our website at springfieldneuropathy.com. You can call our office at 217-787-9300, and you can schedule a free consultation. It's been good talking to you today.